Urinary catheters are a device which is used in a lot of healthcare settings. They're a tube which goes up into the bladder and allows it to drain, helping people who cannot control their bladders or cannot control when they can go. The catheter in the picture is a Foley catheter, and these are used for long periods of time. It's held in place by the inflation of the little balloon at the end, just inside the bladder. And this kind of catheter is often used after surgery and when patients cannot move easily to go to the toilet. There are massive benefits to using catheters, however they have a major flaw. They can be a cause of bacterial infections. The risk of an infection increases for every day that a catheter is in use, and these infections are estimated to cost the NHS more than £1 billion a year. The bacterial infections can be serious as well, leading to pain, fever, and in the worst cases, spreading of the bacteria into the blood and death. The catheter acts like a bridge from the outside to the inside of the body, allowing bacteria access into the bladder. And this bridge is particularly good for bacteria to attach to. Once attached, the bacteria form what we call biofilms. These are groups of bacteria which secrete a sticky substance to protect themselves, and it makes them really hard to get rid of. Antimicrobials are used to get rid of bacteria. These can be antibiotics or other chemicals which can kill the bacteria or stop them from growing. To get rid of a biofilm, though, you need really high concentrations of these antimicrobials. The problem with this is that these high concentrations can also be bad for catheter users, leading to toxic side effects. The aim of my research is to develop a coating which uses these antimicrobials with minimal toxicity and could be applied to the outside and inside of the catheter, hence stopping the bacteria attaching to the catheter. This would allow people to use urinary catheters for longer without the complications of an infection. What I've found so far is that some of the antimicrobials I have tested can be used together, and when used together they can be used in much lower amounts. These low amounts of each antimicrobial, when in combination, can get rid of the biofilms, but they're also less likely to be toxic to the catheter user. The coating I'm using is a liquid into which the antimicrobials are added. This is then spread onto the surface of the catheter, where it dries in a thin layer and holds the antimicrobials in place. This will stop the bacteria from forming these biofilms on the catheter. We've seen that some of these antimicrobials can leave the coating. This would be beneficial, as it may kill the bacteria in the surrounding area as well, preventing them from reaching the surface at all. Almost everyone who uses a catheter will develop an infection. If we can stop these, we could give catheter users better care and help them to be healthier and happier.